Hi, I'm Dr. Ashley Tapscott. I'm a urologist and fellowship trained, specializing in men's sexual health, including erectile dysfunction. I'm here today to talk to you about what you can expect after a penile implant procedure. The inflatable penile implant is designed to match the look and performance of your natural erection. This implant is entirely concealed within the body and is not noticeable from the outside by others. The inflatable penile implant, serving as your new erectile system, is composed of 3 parts. A reservoir is placed in the abdomen. This allows the implant to fill and empty on demand. The fluid is placed in the reservoir at the time of your procedure. This fluid is sterile injectable saline and remains in the system without needing to be refilled. The second component of the inflatable implant are the 2 cylinders. These are placed in the shaft of your penis or cavernosa to serve as your new functional erectile bodies. And the third component of the inflatable penile implant is a pump. This is placed inside the scrotum. There are 3 different approaches of placing an inflatable penile implant. The peniscrotal approach is created with a small opening between your penis and the scrotum. The infrapubic surgical approach has a small opening above where your penis meets your pubic area. And the third approach is what we call subcoronal. This is a circular opening around the shaft of the penis towards the tip. Depending upon which approach your physician used to place your implant, you may have swelling or discomfort in different areas. Talk to your physician about which approach was used and what to expect depending upon this approach. Here are some things to expect after your penile implant procedure. Please understand that each patient and their recovery process has a unique course, and that your surgeon may have a very specific protocol for you to follow. On the day of the procedure, you may go home the same day, or you may spend the night in the hospital. You may have mild swelling, pain, and discomfort. Your implant surgeon may provide special instructions or prescribe medication to help make you more comfortable during your recovery process. It is important that you limit physical activity for the first 48 hours after surgery. This includes heavy lifting, rigorous exercise, and any sexual activity until cleared by your surgeon. Your physician may have other additional information for your unique recovery plan, so please ask and confirm these instructions ahead of time. For a full list of potential complications following the Titan inflatable penile implant procedure, please take a look at the important safety information at the end of our video. Many patients ask questions about the day or 2 following surgery. You may notice bruising and mild bleeding from your incision site. You may also experience possible swelling and discomfort in the bladder area or urethra, the urinary channel. Some men may also have a urinary catheter or a surgical drain in place in the scrotum or the operative site. This is usually removed in the day or 2 following your procedure, at home, in the office, or if you spend the night in the hospital, will be taken out before you leave. Placing an ice pack on the penis and scrotum may help reduce your pain and swelling postoperatively. Wearing a scrotal or athletic support can also make your recovery process easier. It's important for you to understand your recovery time frame. While each implant patient experience is different, in general, the typical recovery period is 4 to 6 weeks. During your recovery time, you may be prescribed medications to help manage discomfort and swelling. In general, you may shower 48 hours after your procedure. The surgical site may be washed with mild soapy water and then pat gently to dry. Please do not engage in any tub baths or soaking, including hot tubs, until your surgeon gives you clearance to do so. Regarding your diet, you should be able to return to your normal eating habits after surgery. Fluids and a well-balanced diet will help ensure a regular voiding pattern and will help promote healing. For diabetic patients, please work closely with your surgeon to control your blood sugars as part of this healthy recovery process. Starting a few days after surgery, it's important that you gently pull down the pump in the scrotum so it stays in a good position. You should not drive while in pain or when taking narcotic pain medication. To promote the best outcome for you, the implant may be left slightly inflated after your procedure. It is best if you wear briefs or similar snug underwear and have the penis facing up towards the abdomen. This will help give the penis the best angle when you're ready to use the prosthesis. Light activity, like walking, can generally be resumed within the first week after your procedure. The addition of more rigorous exercise or workouts will be based on your healing journey and your physician's approval, but can usually be resumed within a few weeks. You may wonder when you can inflate your device. You may inflate your implant once cleared by your surgeon. This may be as soon as 3 to 4 weeks based on your recovery. It's important that you do not attempt to do so without our guidance and instruction. There are important times and circumstances in which you should call your surgeon regarding your postoperative course and your implant. If you experience moderate to severe swelling of the scrotum, or perhaps there's an increase in redness at your incision site. If you are draining a large amount of fluid from your surgical site, you should also contact your surgeon. Other circumstances may include if you're unable to empty your bladder or void, or if you have a fever or increase in body temperature that is higher than 101 degrees Fahrenheit. Let's talk about some don'ts during recovery. For best healing, do not inflate your device without receiving permission and instruction from your surgeon. Also, please do not accept medical advice from anyone other than your implant surgeon. Also, do not worry if you experience slight discomfort, pain, and swelling during your recovery. It is not uncommon to experience these after your procedure. Once you receive the all clear from your surgeon to use your implant, let's discuss how it works. In reviewing the 3 components, the pump in the scrotum, the 2 inflatable cylinders in the penile shaft, and the reservoir, let's review how to activate this. In order to inflate your penile prosthesis, you'll start by squeezing the pump that's in the scrotum. As you perform this, fluid gets transferred from the reservoir into the 2 inflatable penile cylinders in your shaft. Once the implant has reached its maximum capacity, you can use your erection at any status that you choose. When you're done using your implant, you may simply squeeze on the deflation mechanism and the fluid will transfer from the penile shaft back into the reservoir. Now that you've recovered and are using your implant successfully, some men wonder, will anyone notice that I have an implant? It is not obvious by looking at a man that he has an inflatable penile implant, because the device is placed completely inside your body. The penis appears relaxed and normal in the flaccid state, so it is not visibly noticeable. For more information, please speak with your implant physician or visit coloplastmenshealth.com.